Hi, I'm Andrew Miller, and I'm going to do a video abstract on the association between dead space to tidal volume ratio and duration of respiratory support after extubation in critically ill children from Feldman and colleagues. Hi, a little background on the dead space to tidal volume ratio, or VDVT. It has been associated with extubation failure and mortality in children with ARDS, but we don't really know if it can be used to predict the duration of post-extubation respiratory support. And how it's calculated here is you have the PaCO2 minus the PeCO2, which is the mean expired CO2, not the end tidal CO2, divided by the PaCO2. The method, so how the study was done, it was a retrospective study of mechanically ventilated children that had a VDVT documented prior to extubation. They were ventilated between March 2019 and July 2021. Children with trachs, cyanotic heart disease, or had an ERT more than 2 days prior to extubation were excluded. They used the VDVT calculated from the NM3 monitor, which does this automatically, and then they compared those with a VDVT less than 0.3 to those with a VDVT greater than or equal to 0.3, which is kind of a normal, where the normal cutoff is. So results, they enrolled a total of 54 patients. You can see here there was some differences between the two groups based on the VDVT, where the patients with an elevated VDVT were more likely to have respiratory failure, whereas those with a normal or low VDVT were more likely to have be ventilated for postoperative reasons or airway protection. And then you can see here the higher VDVT group also was on the ventilator longer, took them longer to get to their first ERT, and then they also required many more ERTs than the patients with a low VDVT. So their primary outcome was length of respiratory support after extubation, which was defined as the time it took to get to room air. And you can see here a pretty significant difference. So those with a higher VDVT took 6 days to get down to room air versus 2 days, but there was no difference in reintubation. And then importantly, ICU length of stay was also a little bit longer in the patients with a high dead space to tidal volume ratio. This is the alluvial diagram, so this just tracks what happened to the patients over time. So these are the patients with the low or normal VDVT. You can see here most of them are on nasal cannula and room air, and then more room air, and then you can see here by 72 hours, the vast majority of them are on room air, high flow nasal cannula. A couple were reintubated. Then you can see over time some of these cross back over. And then you can see here quite a bit different looking diagram for the patients with an elevated VDVT. You can see here much fewer on room air after a couple days. Lots of other escalated to NIV, back to room air, nasal cannula. A lot of patients on high flow nasal cannula, which are gradually weaned to room air, but some get NIV, some get intubated. I think this is a very nice visual representation of the study findings. And so in conclusion, dead space to tidal volume was associated with duration of post-extubation support, but we really need larger perspective multi-center studies to validate these findings. And thank you. Please subscribe to our YouTube channel. Follow us on LinkedIn, Twitter, or X, and Facebook. Thank you.